The countdown to the first day of the new school year is on. It is the last week of summer break for hundreds of thousands of students.
And right now, the focus for many is on back to school supplies, but it's equally important to take time to get in those doctor visits for everyone and look over the back to school health checklist.
Yes, so to help us with that, we'd like to welcome back Minute Clinic nurse Deborah Michaud. She has a 3-point checklist to make sure your child is ready for to get back into school with your health returns, all your forms, you name it. What do parents need to know before they get into the doctor's appointment?
Okay, so there's 3 things. I think we want to start with the kindergartners, the ones that are just going for the first time.
The fresh
right.
meat.
Mm-hmm. So I always bring the hand wash just because it's what we want to teach the children. Always at home, it's good just to get them used to washing their hands, maybe singing the happy birthday song so they know that's how long I should be washing.
Oh, that's a good one.
So so just sing happy birthday and then try to tell them not to touch their face and with their nose, their mouth, and then they're touching, and that's where they pick up strep and flu and pink eye. Those are the things we see often. So those are the big things. And then for coughing, sneezing, obviously if they have tissues, great. But if not, they can use, kind of go in their sleeve. I see a lot of people, they'll pick up their outfit and they'll just kind of cough into there. And then not to share water bottles, any of the utensils, food, towels. Big ones are like hats and scarves because that's where you pick up lice. So we don't think about those things, but those are huge. Yeah.
And so a lot of kids need vaccines before they go back to school, but even if your kid isn't due any vaccines, why should they still do a back to school physical?
They should, especially if they are into sports. So any type of sports activity, they're going to need a pre-participation clearance. So there's sports physicals, there's school physicals, all of which are provided at Minute Clinic or like the stores. So they're both offered there. A child entering for the first time in the state of Florida has to have at least one physical in the last 12 months. So that piece is important. So they need to have that proof. And then that brings us to the next segment, which is the vaccines. And people who are moving into Florida or going to school are going to need what we call the Florida Form 680. Also known as blue form, yellow form. It doesn't make any difference on paper. It's just because we'll print it out in white in the clinic. But we have the ability to download all of the vaccines from all of the states. And it's actually a good thing. At first I was like, wow, this is crazy. But it's all of the vaccines are in one place. So any provider in the state of Florida can actually pull up the vaccines that a child has had. And there's also another form that says, here's their history. So are they new? When are they due for the next vaccine? So that's always helpful for people, especially when we get into meningitis and HPV and that kind of thing. So those are big.
Yeah, and you. Oh, go ahead.
No,
you mentioned meningitis. I know that's important for students who are heading to college, especially. Why is that?
Correct. So the college ones are the meningitis, the meningococcal conjugate, and then there's also meningitis B. Both of those are because they're in a large group of people, close quarters, and it's very contagious. So it can go viral or bacterial. Viral is the most common, but bacterial can be deadly. So 10 to 15% of the people with meningitis bacterial can actually die. So kind of getting ahead of myself a little bit on that, but because meningitis has to do with the covering of the brain and the spinal cord. So when it attacks that area, we have to be really on it and be able to notice the side effects of that, which are similar to flu. So we're getting into that season as well. So fever, body aches, and there's other, like headache and the stiff neck is probably the one that's the key. Nausea, vomiting, those kind of things. So we really need to kind of catch that as far as bacterial meningitis very quickly. So within 24 hours so that antibiotics can be started. And that's usually going to be done through a blood test or a spinal tap, and that actually is a patient would be referred to the emergency room for that. So the other things for the children, the ones that are required are you're going to be your Tdap, your hepatitis B, your MMRs, and your varicella or chickenpox vaccines. Those are the ones required to get into school. Of course, 7th graders require a booster for the Tdap. And then that's also the good age to start the meningococcal vaccine, because you can start the meningitis vaccine at 7th grade. And the meningitis B is like 16 or college freshmen. So those are the ones going into that.
And what about some of those guidelines that have changed around the HPV vaccine and, who you recommend should get that?
So believe it or not, boys and girls between age 11 and 12 should get the HPV vaccine. By getting that, you're actually working to prevent cancers in the future later in life.
And I mean, it's really difficult sometimes to know what dose your kid is on, what, so you were saying, so that form, that you guys can pull that up
Yes.
and find out exactly what's
Exactly.
due when it needs to be done. So
That's
there's not a lot
exactly
of
right.
research that needs to be done beforehand.
Exactly, and as we give vaccines, even in the clinic, we update that Florida form, and then we print out a new one so that they have it for the school, they have it for the parents. I always print 2 because I want the parents to have one, and they
Yes.
don't always have a printer. So it's just good to have one for themselves, and if they don't, and if they have a printer, they can have one to give to their child as they grow up. And here's your vaccines. I wish that I had that, because I
Yes,
don't.
right?
Right.
Well,
All right.
great information. So we can come by Minute Clinic and get help with all of this.
Absolutely, we're here, and we're in all over Central Florida, so
Wonderful. Thank you so much.
thank you.
Great to
Appreciate